I am Dr. Kiran Kumar K, consultant psychiatrist and director of the Nirvana Center at Marathahalli, Bangalore. Couple therapy or marital therapy is a very specialized form of psychotherapy. Marital therapy and couple therapy are certainly different when you look at it technically, but today I'll be using it as a single parlance. Marriage and divorce has been known since time immemorial. Marriage is a social construct, it has its own advantages and to some extent some disadvantages. But divorce as a phenomenon is been growing and has been growing exponentially in today's world. The reason for divorce can be diverse. It can be because of globalization, urbanization, westernization, the gender roles, the gender gap, etc. It can go on. But what is happening to the prevalence of divorce? If you look at some of the studies, the prevalence of divorce has raised from 0.5 per thousand marriages, which was in 1988, to currently about 13 divorces for every 1000 marriages in 2019. Now, as a psychiatrist or a mental health professional, I am not much worried about the rates or the prevalence of divorce. I am much more worried about the dynamic factors that leads to divorce. And it's very trivial of late between young couples. The reason for it again are quite enormous. It can be the fast-paced life, it can be nuclear families, it can be both couples working. So the differences and conflicts are raising. So what happens when two couples come for a marital therapy or a marital counseling or a couple therapy? The therapist first interviews both the clients either separately, individually, and then probably a joint session. The therapist tries to understand what are the client needs and then try to see what are the areas of conflict. So basically the therapist looking at from a different vantage points, things looks clearer because the therapist is a neutral, non-judgmental person. So in a client-centered approach or in a couple-centered approach, the conflicts in insight is given to the level of conflict. Ideas are given how to resolve the conflict, how to improve communication skills. But the second part of the problem is just not getting an insight to the problem, but in putting it in daily needs. How does that happen? That occurs in sessions. Please note, marital therapy or couple sessions cannot be finished in a single session. There are multitudes of sessions, but it is definitely not very long term. It is definitely for a short duration, and it is structured where ideas will be given, homeworks will be given for the couples, and they will be taught how to resolve their conflicts. In case of marital issues and any discord, kindly meet your mental health professional and in turn a therapist to resolve all your marital issues. Thank you.